Hello everyone, my name is Angela DeRolf and I'm your Perry County Health Commissioner working with the Perry County Health Department. And tonight I wanted to do a quick video on the stay-at-home order that will take effect at 11:59 p.m. tonight. So the stay-at-home order, this is the director's orders, which includes the entire state. Unless you work for an essential business or are doing essential activity, you should stay home. Work from home, however, is permitted and encouraged when possible. So we have posted the stay-at-home order on our Facebook page, as well as a frequently asked questions sheet that the Ohio Department of Health has put out. So if you have any questions about the order, please go to our Facebook page and look at this information. We have also made a list of some of the essential services, which include but are not limited to grocery stores. Grocery stores are not going to be closing. Gas stations, pharmacies, police stations, fire stations, laundromats, all of these essential services will remain open. Hospitals, clinics, and other healthcare operations, garbage and sanitation, public transportation, public benefits, for instance, SNAP or Medicaid, and some of the hotlines, those are going to remain open as well. If you are a business and you are not sure if you are essential after reading the order, consider a couple questions. First of all, are you a part of the essential supply chain, or are you providing goods or services to businesses that are identified as essential? If you can answer yes, then maybe you need to consider, can you provide a safe and clean work environment for your employees where you practice social distancing from more than 6 feet apart from one another? And if you can answer yes again, then you probably are essential. This is something that your business is going to have to determine for yourself after taking these or answering these couple of questions. If you have been designated essential by your employer, you should continue to go to work and practice social distancing. If at any time you experience symptoms or are currently in isolation, you need to stay home and follow the guidelines provided by your physician. For your safety, as well as the safety of those in your community, you should remain at home to help us fight the spread of COVID-19. You may, however, travel to care for elderly, minors, dependents, person with disabilities, or other vulnerable people. However, if possible, we recommend that if you are dropping off supplies, food, and medications to those relatives or friends or anyone that needs assistance, that you do so, just drop it off and really avoid minimize your interaction with those folks. So what about your pets? Yes, you can still go out and walk your dog. If your dog gets sick, you can still seek medical attention for your dog. However, when you're doing so, please practice social distancing. Maintain at least 6 feet away from your neighbors and their pets. You can still take your kids outside to play. Families can still go outside, including parks and outdoor spaces that remain open. You can go on walks and runs and ride your bikes and do all that fun stuff as long as you practice social distancing by remaining 6 feet away from other people. Also keep in mind that playgrounds are closed because they pose a high risk of increasing transmission. Exercising. Exercising can be a great stress reliever. So yes, you can exercise. You can run, bike, do things outdoors. That's all perfectly acceptable. But just know that gyms, fitness centers, and other facilities are closed to reduce the spread of COVID-19. So when you are exercising outdoors or in your home, just remember to keep your social distancing at least 6 feet away from other people. Help us help you. You must stay at home to help us slow the spread. It's crucial for this to happen over the next few weeks, as all across Ohio we continue to work to build our capacity for our hospital systems and healthcare providers. We across Ohio are looking at personnel needs, whether we need to bring physicians out of retirement or what roles can medical students use. But even on a larger scale, we are in need of PPE, which is personal protective equipment. So we are trying to make sure our first responders and healthcare providers can keep themselves safe in order to help you. So I'm asking you, if you are a business out there that has closed or you no longer need personal protective equipment such as masks or gloves or gowns, please contact the health department, as we are working hard to make sure that our first responders and healthcare providers are protected so when you need them, they can help you. Medical care: if you are having symptoms of COVID-19, the fever, the cough, shortness of breath, or you've been around somebody that's had COVID-19 in the last 14 days, you need to contact your healthcare provider. He or she will work with you to determine if you should be tested. For those of you that have been concerned about testing and been asking the questions about testing, please know that not everyone will be tested. And just because you get tested, that doesn't change the treatment. If you feel ill, act as if you have COVID-19. Stay home and take care of yourself. Isolate yourself from others in your home. Rest, drink plenty of fluids, and if need be, take medications to relieve the symptoms. But at this time, there is no cure or treatment for COVID-19. So keep that in mind. You need to stay home and take care of yourself. Again, ways that you can protect yourself, I think I talk about this on every video, is make sure you stay home when you're sick, avoid contact with sick people, get adequate sleep and eat a well-balanced diet, wash your hands frequently with hot soapy water for at least 20 seconds. If you don't have access to hot soapy water, sanitizer with greater than 60% alcohol, you can use that. Cover your mouth when you sneeze and cough with a tissue. Throw the tissue away. Wash your hands again. Avoid touching your eyes, your nose, your mouth. Clean and disinfect high-touch surfaces often. You know, your doorknobs, your phones, your remote controls. Think of all these places and clean and disinfect often. And I can't stress this enough. If you feel sick, call ahead before visiting your doctor. Again, seek out credible information. coronavirus.ohio.gov. They continually update their website with new information. Call the ODH Hotline, the 1-833-427-5634. It's open from 9 a.m. to 8 p.m. every day, and it's staffed by licensed nurses and infectious disease experts that can answer your calls. And then continue to watch our Facebook page as we provide you with up-to-date information. Lastly, I can't stress this enough, seek out credible information like I just shared, but also take a few minutes to be nice. A smile and a kind word goes a long way, especially when you're dealing with folks in the community providing those essential services to you when you go into your grocery store or your gas station. A kind word and some encouragement goes a long way. Those people are still working to provide things that you need, so thank them. And then lastly, if you have any suggestions or hear of resource needs in your community, please contact the health department. Thank you.